So the question is direct primary care worth it? And I would argue, yes, across the board, yes. But my opinions are not yours. And we really need to address a couple of different factors that for a patient would make direct primary care worth it or not worth it to them. The two most common reasons of why somebody seeks a direct primary care practice, number one is financial and looking to save money and improve their care. That's the first reason why patients would come to me. And for those, you really are looking at patients who either have no insurance at all, or they have a high deductible insurance plan. So we're talking $5, $6, $7, $8, even up to $9,000 deductible that they're responsible for out of pocket before their insurance kicks in. And those systems work really well with a practice like mine. We are considered a wraparound to a high deductible catastrophic level type plan. And by utilizing our pricing structure for your everyday care and utilizing us and our pricing for labs, imaging, and other things of that nature, most patients can get drastically more care for a fraction of the price and without ever dipping into their insurance. What we like to tell patients is that insurance is for catastrophic problems. Put it in your pocket, forget about it, and only touch it if you have a major accident or a surgery. And that's how you can save hundreds to thousands of dollars per year and get more and better care. The second thing is the financial savings doesn't apply to every patient. I wish it did, but it doesn't. What you have is the most common reason of why it would not apply to you is someone who has a really high quality employer sponsored plan. So for example, you work at a job and your employer provides you with a platinum gold level plan that has a $200 deductible, if that, and a really good co-insurance plan. They cover all of your medications and labs. Those kinds of things financially, you're not going to be saving any money with a direct primary care practice. I wish you could. But what you do get is a level of care that you cannot match in a traditional healthcare system. And what I mean by that is if you were to call your regular doctor in traditional medical practice and you wanted to be seen, most of the time you're going to get feedback of our next availability is in 3 weeks. You can be seen for a 10 to 15 minute appointment. You have to go to this specialist and this specialist because we don't have time to figure out what's going on. And a lot of patients in this system, even though they have really good insurance, they may find themselves going to urgent care or the ER for simple problems that could have been seen by their primary care doctor, but because they're so busy, they couldn't get in. And that happens all of the time. So on a surface level, is it worth it financially for this patient? Maybe, maybe not. They may find themselves paying more because of utilizing a direct primary care membership, but what they do get is access to care, access to a provider who can talk to them directly, who they can virtual chat with, who will come to their home, that they can spend an hour with and not get stuck in a 10-minute visit cycle. And there's a lot more to do with what we can do, how often we see you, how affordable it is, and just continuity of care. So I would argue, yes, direct primary care is worth it, especially financially if you have no insurance or a high deductible insurance plan, but it's also worth it to get concierge level access for somebody who has really good insurance. And if you're interested in learning more, please feel free to schedule a consultation. I'm Jason with Starlight Health.